Hi guys, we're going to talk about hip flexors today, so how to stretch them and why they're so important basically. Okay, so basically the hip flexors run, two of the hip flexors are quite internal, so they run at the front of the spine and then inside the pelvis, and they come in and attach on the inside of the groin here. Okay, one of the other main ones is what's called the rectus femoris. So attaches to the bottom of the knee here and comes up and touches to the top of the pelvis here. Okay, and so what the hip flexors do is flex the hip essentially. Okay, and with a lot of people at desks or at home not doing as much as they normally would, this muscle is becoming very tight and very restrictive on the lower back, on the knees, having big effects up and down the body. Okay, so I'm just going to show you a nice simple stretch to go through that today. Okay, so this is my go-to hip flexor stretch. And so what you want to do, have the back toe up, have this knee down. May want to put a pillow underneath there, and then we're going to bring the foot out in front of you. And so what I recommend to people is this foot here, just here as a stabilizer. What I don't like to see is kind of having it too close to here, just puts unnecessary load through the knee. Okay, so have it nice out so you can 90 degrees through here. And so what we want to do is have your kind of starting position set up really nicely. So brace the abs, almost imagine bring the belly button up towards the chest, squeezing the bum muscle, and what I kind of get patients to kind of have their hands on the base of the bum and onto the stomach, just to kind of give them that feedback. Okay, so you can see the kind of shape of my back now compared to where we've contracted those muscles and activated that. Then from here, what we want to do is we're not arching the back, but we're shifting the pelvis, shifting the hip forwards. Okay, so we're almost kind of thrusting the hip forwards, just very gently. And what you'll feel a stretch through the front, so front of the leg down here, and sometimes up into the top of the pelvis, into the hip here as well. And so this is a really good stretch to do. And quite a calculation I give to patients is for every hour that you sit down, is a minute each side for that stretch. Okay, yeah, try and do this one kind of throughout the day. Don't spend, if you sit for 10 hours, don't then do 20 minutes of stretching. One, you'll be bored as hell by the end of it, and two, yes, it's much more effective if you spread it throughout the day. Okay, if you want any more hip flexor videos, let me know, and we'll see what comes of that. Okay.